Implant choice, completely up to you guys. Use whatever you want. We're teaching Blue Sky here because we use it in the office. We find that it's a nice blend of overhead, performance, easeability of restoration, because the platform choices are very universal. The Noble Mac, the what's called, the NP platform is very, very utilized in a lot of parts. You can get third party from Blue Sky or from Dentist, everything like that. Now, we have to choose what length we use. That's decided in our preoperative planning. Taper is very important. That's why one of the things we're a little bit unhappy about using Blue Skies for is it's very conical. So we have 2 implants in stock in our office. One is the Blue Sky Bio Max, and the second one is the Blue Sky Forte. The Forte is in this picture. So it's a little bit more tapered than the Max. The threads are a little bit more aggressive. And we use the Forte in the maxilla where there's a very spongy bone. And for the Blue Sky Bio Max, that's the standard Blue Sky Bio implant, we do a lot of mandibular surgeries with it because a lot of cortical bone. You're not worried as much about achieving the primary stability that you want. But in the maxilla, these aggressive threads here, we find that it compresses bone enough so you can load the same day. And a lot of the times that we had failure is because we did not have an aggressive enough implant up there. You get brave sometimes with the torque values when you're working because cross arch stability is a thing, but it's only a thing up to a certain cross arch stability sum value of torque. Questions? I know there's a lot of good ones already, but basically any sort of tips about doing this surgical considerations before we start the hands-on approach.
So, I don't know if anyone else has experienced really beefy soft tissue incision where you can't on the maxilla.
With a lot of perio and a lot of,
somebody who's actually a dentist, and I couldn't flat this guy for anything. I was going to actually have him come in, place some bone, and suture him up and see if I can get some bone cut.
So you said completely edentulous patient.
Yeah.
I'm guessing thin ridges, right?
Really thin.
Yeah, and a maxilla, mandible.
Like one side was atrophied away and the other one was there. So I couldn't even, we're talking 7-8 millimeters thick.
Yeah, it's tough to work with that.
Where I couldn't get it to reflect at all, and let alone.
I mean, in my experience, like the maximum you can do is try to get as deep as possible passing the periosteum, because periosteum holds it up so much. And releasing incisions, that's pretty much my best guess as to how to.
That's, at that point,
the
assistant starts looking at you.
Yeah.
You're a butcher. What are you doing?
So you don't know anything, you're an assistant, Sean. Just be like a man, pull out your scissors.
I know, that's a,
Yeah.
Dang, that's not bad. Does anybody have any tricks or have they learned anything with that?
Here, I have a nice one that's a little bit simple, but it helps a lot of the times when you're struggling to get the periosteum released. So after you use your 15 or 12 or whatever blade you want to use, you have an incision fully crestal along the edge of it. You don't know if there's any sort of tags of periosteum holding it up, because your blade has a diameter, and sometimes those invaginations are not cut by it. So a lot of the times that I do this, I run an explorer in the first incision and basically have an intimate connection with bone all the way across. And you will 100% feel tags of periosteum there. You just pull up on it and rip them off. It sounds so simple, but it helps with flaps such a significant amount.
Another thing, James, I was thinking on a real fixed maxilla though, you have to make sure that you can feel your crest with your blade, because you'll be too palatal or you'll be too buccal and you're not hitting bone. So you got to find the angle to where you hit bone and then score your bone and make sure you're scoring bone your entire incision, right? I think personally, that's where I went.
Might be dropping on the palatal side.
Yeah, it happens. It's really
soft tissue.
Yes. You miss the bony bridge because it's so narrow. So you have to kind of angle and you have to sound that bone, and then you got to stay on your bone as you cut around the ridge.
Wow, 7-8 millimeters. That's a that's a chunky tissue. Yeah.
It'd be hard though sometimes on a towel like that.
There is a chapter in Zero Bone Loss Concepts that I was just reading.
It's a great read.
Last month. He talks about situations where the tissues are too thick and you have to trim them back with diamonds and reduce their tissue. And he talks about leveling out tissue by 3 or 4 millimeters sometimes to be able to have an ideal situation.
You said with diamonds, right?
Details. What?
With diamond burrs?
Yeah, just
yeah.
like diamond. I don't remember
Yeah.
the details, but I don't know if you have the book, but there is a chapter on tissue reduction there for ideal restorations for implants, etc. I don't know if that'll help.